It is a huge honor today to be interviewing a real role model of mine, Eric Jackson. I feel like we have so much in common. We're both DDS. We're both masters in the Academy of General Dentistry. We both have our fellowship in International Congress Oral Implantology, and on and on and on and on. And I have really gone to school following you on social media too. I mean, you were the first person I know who you just did it all right. It was your social media posts are educating and informative. I always want to read them, and I can just imagine how your patients wondering. How are you doing today?
I'm doing fantastic. Thank you. Thank you for the kind words. That's fantastic. I mean, coming from someone like yourself with admittedly some of the top posts around, means a lot to me. Thank you.
Oh, hey. And so I want to start off. I mean, there's so many things I could talk to you about. I mean, you're a master clinician. You're an implantologist. You're a successful businessman. You're the top 0.01% social media marketing that I've ever seen, and I've been on social media pretty big time since 1998. First of all, I think I want to start was getting you have so many initials behind your names. Talk to these young kids. Was it important looking back? Was joining the Academy of General Dentistry and earning your fellowship and then going on to earn your mastership, looking back, was that a good idea for you?
It was immensely important. I've been very fortunate to meet some of the best people in dentistry through the AGD. And, I was very blessed. I went to University of Illinois at Chicago for dental school. But in the end, I'm sure you could attest, that only starts you out. That's your basic building blocks. And then you got to start kind of expanding what really interests you and what's the real world way of doing things. And I found all that through a variety of ways through the AGD, mentorship and all the different classes. And then all of a sudden you start stringing a few classes together and you say, oh, wow, what's that fellowship about? And maybe I could get a nice goal for myself. And then that becomes mastership and so on and so forth. Continuing education and the people that you meet through it, a fantastic, fantastic thing for me in my career.
I look back and I think that was the single game changer I did in dentistry. And yeah. I tell a funny story because when I was getting my fellowship in the Academy of General Dentistry, back in the day, you had to have 500 hours and then pass an all-day exam and practice 5 years. So it was about 100 hours a year for 5 years. And they kept wanting me to take these classes in subjects that I didn't do. I didn't do orthodontics. I didn't do implants. So I complained to my local, and they said no. And I went all the way up to the very top. And this older guy just said, he said, Howard, you got to be cross-trained.
Yeah.
And, Carl Misch says that he didn't become a great implantologist if he wouldn't have had his foundation in removable. He said what got him interested in implantology was that these people putting dentures over implants, and the implants were breaking, and they were blaming it on the implants. And he said, no, it was you don't understand how to make a denture. You got to get the bite first.
That's right.
And if you put a bunch of implants in and the bite's horrendous and they don't function properly, then everything's going to go whack. And he credits mastering dentures as his groundwork to mastering implantology.
I've always said it's all about reverse, especially with implants. It's reverse engineering the case. Whether you kind of figure out your destination and then you bring it back to where you are now, it really helps to kind of set the path for the patient, and the treatment plan just kind of flows out of you. All right, well, I need to have implants here, here, and here if possible. How are we going to do that? And we can kind of figure that out that way.
And I don't want to piss off a bunch of people, but I will. Some of these things that these TMD experts say, you can tell they've never done one case of orthodontics. I mean, about at least 20% of everything they say just goes out the window if they just did a few orthodontic classes and treatments.
Well, and that's the benefit of having the fellowships and the masterships of the AGD behind you. You're able to sit in a lecture or listen to a presentation and really kind of decide what works for you. And after you've heard hours and hours and hours of this, you're able to kind of figure out what jives with your own philosophy. And I know I'm the son of an orthodontist, and
I should have made that comment.
No, but you're 100% correct. You have to be multidisciplined, because if you don't appreciate what the orthodontist can do, in their wide scope, then how can you apply even some of that as a general dentist? And the concepts of just tooth movement, for example, whether you're doing Invisalign or you're doing the veneering cases that could instantly straighten people's teeth, that's really important. It's the foundation that's just no longer are you locked into one avenue of dentistry. It's absolutely melded more than it ever has been before.
And the MAGD also set the groundwork for my mind for Dentaltown, because as I was joining the MAGD back in '87, and I was realizing that I was thinking when I would get back from these courses that the most I learned was from the people I meet and with having lunch with them and going to the bar afterwards and having cheeseburgers and watching the football game. And it's like I would go back and I'd have 6 pages from the bar of notes and 4 pages from Dale. And that's when I saw the internet, is that if we could just all get together and start talking, we would all win.
Absolutely. I mean, Dentaltown in itself is essentially the exact mode of what you want. You want to be able to rub elbows with people who are better than you and different than you. And then in turn, once you get better, then you can rub elbows with somebody who needs your assistance. I'm sure one of the main reasons why you founded it. It's why it's such a fantastic resource to the profession, because whether you're God's gift to dentistry or you just graduated yesterday, there's something on there for everybody. And it's no different than rubbing elbows with your local organizations or your regional, or in this situation, you could be rubbing elbows with somebody in Malaysia on Dentaltown and really learn how they're doing it, and vice versa also.
And then to you young kids, that just got out of school, I want to remind you that we all know what we know, but we don't know what we don't know. And I'm sure 1,000 years from now, a lot of everything we believe is going to look crazy.
Oh, absolutely. I've always joked my grandkids are going to laugh and say, Grandpa, you screwed titanium screws into somebody's head. Why didn't you just grow the tooth in a petri dish like everybody else does these days? I'm like, but we're cutting edge right now. It all changes, and especially these days, so rapidly. With the dissemination of information and the overall knowledge pool just doubling, annually or every 6 months, it just really makes it all the more important to stay on top of your stuff as a dentist.
Well, Eric, you said you lecture sometimes at your study clubs and stuff.
Yeah, I have.
If you got an hour lecture, I'd give anything to have you put it up on Dentaltown.
I'd love to.
Yeah, I would absolutely love that, because I just think you're a hell of a guy. You're a hell of a clinician. You're a hell of a social media. I just think you're a hell of a guy. And I just want to tell you, we're 2 minutes over time, but thank you so much for spending an hour with me today. I just think, and thank you for all you do for dentistry and your the CDS Foundation, the DuPage County Health. I mean, everything. You're just a hell of a guy. Thank you so much for spending an hour with me today.
It means a lot coming from a guy like you. You're somebody that I've sat in your lectures and your MBA for dentistry courses and things, and it's just fantastic being able to sit here. This is exactly what I wanted to have when I was young. First year out, second year out, being able to rub elbows with somebody the likes of Howard Farran or the likes of anybody else in that league. I mean, really, we're talking A-list people here, and here I am sitting Skyping with you, and it's fantastic.
Thanks, buddy. Well, thanks, and I hope you have a rockin' hot rest of the day.
You too. Thank you very much.